In terms of offering patients what I consider to be top service, top medical care, I try to establish a personal relationship with families and the patients themselves, obviously. I try to find out what that patient does, learn about where they live, what their interests are, what their family's like. So you get to know the patient as a person, not just as a disease entity. I frequently will see patients in the office the same day that a referral comes into the office or the next day. Sometimes it's because patients have been diagnosed with a brain aneurysm or have a stroke or an arteriovenous malformation of the brain, and they're scared. They're very anxious. They've been given a new diagnosis. Often they go online and they find things that sometimes are accurate, sometimes are not accurate. Regardless, they're often scared tremendously, and sometimes being able to see a neurosurgeon within 12 or 24 hours serves the function of allaying their fears. Sometimes they need emergent surgery, and that's good for them to know. Sometimes they just need reassurance. I try to give all of my patients concierge-level medicine, and that includes often giving them my personal cell phone. People have strokes, ruptured brain aneurysms 24/7, and I like to consider myself a 24/7 doctor. And a lot of my referrals will come in all weekend long at all hours of the night. And I'm kind of happy to take those because I think that that's what I bought into when I went into neurosurgery. I think this is a 24/7 business, particularly in the field of vascular neurosurgery, which is my passion. Technologies continue to come to the fore almost daily. And so it's important to stay on top of those so that you feel like you're really offering your patient modern day medicine. In our organization, because I respect this idea that different doctors might have different opinions, and because I do feel that particularly for these higher risk problems such as brain aneurysms or carotid stenosis, I feel that people are entitled to at least have their films reviewed by multiple doctors. I will not only often show the pictures to 2 or 3 of my colleagues here at NSPC who have done those operations to make sure that we're all on the same page, but additionally, I do run a weekly vascular conference where there might be 20 or 30 attendees, and we'll actually present the cases that I'm planning for surgery so that we actually get a discussion among many different physicians to try to make sure that we're all on the same page regarding the best recommended therapy for a given patient. So any patient that I end up operating on has almost de facto gotten several opinions, whether they realize it or not, before proceeding with one of these high-risk procedures. I myself do all my surgeries. I am there from start to finish. We don't have medical students or residents scrubbing in on these cases. I feel, again, particularly for the vascular lesions such as aneurysms, carotid surgery, AVM surgery, I think that patients simply do better if there's an experienced surgeon who's there from start to finish, who's actually doing the procedure. I feel like I have a skill set that can be used to help people and to save lives. And that's a real privilege and a real gift, and I don't take that for granted. I feel sometimes like I get up every day and I'm like a fireman who runs into a burning building and grabs a 3-year-old and carries them down on my shoulders, and that's an amazing feeling, and I feel like I get to do that 2 or 3 times a week sometimes. So I definitely enjoy being involved with difficult, complex procedures that require 10 or 20 years of training to master, to be able to do them successfully, and then to, on a daily basis, try to rise up to that challenge and try to do these procedures which are high risk and complex, and to hopefully make them look easy and hopefully deliver a very complex service to patients to help them get back to their families.